to COVID-19 Talk with Local Health Authorities. With me is Dr. David Persse, representing the City of Houston, and Dr. Umair Shah, representing Harris County. And this is your last show, Umair.
This is my last show, Stephen, David. Last show, tomorrow's my last day at Harris County. You know, it's bittersweet, obviously. Leaving to become the Secretary of Health in the state of Washington is exciting and fantastic and such an honor and privilege. But the bittersweet part is just leaving this community behind and leaving people like you behind. David, you and I have been working hand in hand, day and night, 15, 20 times a day calls every, during this pandemic and beyond. And Stephen, you and I, the health departments and working together all these years, and I've leaned on both of you. I've respected both of you. You've become my friends. You've become my people that I can lean on and cry to. And I just want to say thank you to both of you for everything you have meant to this community. A lot of times people don't know behind the scenes the work that both of you do. I know a few weeks ago I snapped a photo of both of you working right after the show, and it's one of the precious gems of pictures that I have of the two of you. And so thank you for letting me be a part of this, both of you.
Well, we really appreciate your being here on the show, but more importantly, being in the position that you have been for over the last few years. And I really want to tell you that your energy is going to be missed. You always bring up a number of the hard questions and challenges that we have to wrestle. Well, sometimes, you know, I'd be wanting you to hush, but it's only because I want to move on. But, you know, I'm really grateful for what you've contributed to Harris County. And I'm sure you'll do very well in Washington. Just be yourself.
Thank you, and I hope you two both come visit. It's a little cooler, I
ain't
heard.
coming up there now. I'm sorry.
We'll come up maybe in August. How's the weather in
Maybe
August?
in July, right?
Yeah. And Houston is where I want to be, you know, especially during COVID.
That's right.
I'm not going anywhere.
You got it.
Remember, this show is brought to you by Rotary Club of Houston, and we have past President Kathy Finninger in the audience just to say goodbye to Umair, and we'll do that a little later. But we're going to jump right into the questions. I probably will be cutting you off because I want to get through the stack.
Sure.
Okay. David Persse, you recently shared the results of the random sampling that showed there were 4 times more cases than reported. This study seems very proactive. How does it track with the wastewater tests?
So it's a great question, and there's like true and unrelated. So the wastewater testing is showing us in neighborhoods whether or not the virus is increasing or decreasing, and we can go back and kind of guesstimate within that water catchment area how many people are infected. But we only started it. So this prevalence study was actually done before we started with the calculations for the wastewater. So it's kind of hard to answer that question.
Okay. When do you project we will hit herd immunity? Umair.
Yeah, it's a good question. You know, it's hard to know when we're going to hit herd immunity because it's a combination. Herd immunity is essentially that we have enough people that are either infected by and have developed immunity or have received vaccination. They developed enough of an immunity that it actually essentially cocoons those who cannot, for example, get a vaccination because of some reason. So there are a lot of estimates on what that looks like in our community or even across the globe, and we don't really know, but what we do know is that we're now seeing the light at the end of this long tunnel, which is vaccinations. And this week, my last week, I'm so proud of the fact that we are seeing vaccines in this community, which is fantastic. But what that means, Stephen, is that it's likely going to be several months before we actually get everybody get into a line to get vaccinated. And it's going to be summer. It's going to be long months till we get to that point. And so by the time fall, this is my prediction, and I'm leaving so I can make the prediction. By the time fall opens up with schools, I'm hopeful that we're going to be in a markedly different place where we can actually talk about in-person school safely, and we've got everybody, as many people vaccinated as possible.
Absolutely, and the hope is that people will be willing to take the vaccine. That's really important.
That's right.
Okay, do you have an opinion of the drug ivermectin as a treatment and preventative?
I do not.
You don't have it?
No.
That means you're going to Google it doing
That's
that.
right.
Figure out what it is. All right, we got that. When arriving at IAH on international flights, the lines for passport control are long, roped off, and no distancing is practiced. We were in line with approximately 200 people from who knows where for at least 45 minutes with no social distancing. It's the first time I've felt at risk. Can anything be done about this?
Yeah, we need to reach out to the folks at the airport. Actually, that is, we can talk to the folks at the airport because they work with the city, obviously, but that's a CDC area, or it's a federal, it's the federal government area. But I had thought that they had already addressed that at one point, so maybe things got lax. We'll have to recheck that.
Yeah. We can actually send an email to our airport colleagues. On Tuesday, the FDA approved the emergency use of over-the-counter rapid antigen test on Tuesday that takes 20 minutes. Can we rely on the results?
Well, you know, preliminary, what the data look like is that you should be able to rely on those results. But again, all these tests, we have to remember that they have to be taken in some context. You have to know why you're testing, what the tests can be used for, and when you are getting tested, especially in the disease process, and what a positive and negative test means. So all that's in part of what the FDA has approved. But again, this is promising because testing remains cornerstone, but we have to make sure we know those caveats.
Okay, I'm going to answer this. And the question was about Moderna and its vaccine. Yes, it will follow the same process as the Pfizer vaccine followed. The shipping of the vaccines will occur as soon as the approval is announced. Yeah. Vaccines for two groups with pre-existing conditions like diabetes. What do we need to prove we are in that category? If my diabetes is well controlled, does that push me down on the list? Do I have to go to a pharmacy who knows my medication to prove my condition?
I don't know that we've got guidance or clearance on that yet from the state as to how that's going to be verified, as opposed to people just showing up and saying.
No, right. All of that actually is in process. The 1B category is being discussed as we speak. I'm unable to drive. Will there be any mobile units? The answer to that is yes, both from the city and from the county.
That's right.
We're hoping to take a trip as soon as possible after receiving the vaccine and suspect we will need documentation. What proof will be sufficient to travel?
So, so a couple of the airlines are getting together to create basically an app to, so that people will be able to either, show that they've been vaccinated or that they were tested and they tested negative. And so those are in development now. So expect to see those, I would say, in the next month or so, maybe 2 months.
Yeah, that's right.
Yeah.
Thank you for joining us with COVID-19 Talks with Local Health Authorities. We'll be right back. That question that came up is going to be...
Hello, Houston. Now more than ever, communication with our neighbors is critical as we work together to prevent the spread of COVID-19. It's important to get updates about resources, testing, and safety practices. Sign up for neighborhood updates to receive automated voice and text messages in English and Spanish. This new resource is available for anyone interested in receiving messages without needing a smartphone or access to the internet, especially our seniors. To subscribe to neighborhood updates, call 311 today and enroll.
Things could be stranger, but I don't know how. I'm going through changes, through all of the strangeness. I'm going through changes now.
Wash, washy, wash, washy, wash, wash your hands. Scrub it while you sing the song. Wash, washy, wash, washy, wash, wash. Rub your hands and fingers and the places in between. Using soap and water makes your hands so clean. Wash your hands. Great job, you're almost done. 5, 4, 3, 2, 1, now dry.
Wash your hands for 20 seconds, just like Elmo.
Welcome back to COVID-19 Talk with Local Health Authorities. We had a couple of questions come in regarding vaccine during the break, so take it away.
So, the question is about mRNA as a vaccine, and so there's a couple of things that a lot of people don't know. mRNA vaccines are they're relatively new in this application, but they're not entirely new. So there are already some anti-cancer vaccines that are mRNA. They've been out there, and so the healthcare industry does have experience with mRNA. The other thing is mRNA is a thing which is in every single one of your cells right now doing a job. mRNA is not some foreign, crazy thing that's been. It's like a barcode. I've been using the example. It's a barcode. It's the way that the the DNA inside the nucleus tells the cell structures outside the nucleus what to do, and so it's a very common thing. So so for this application, it's new, but mRNA and vaccines, mRNA and vaccines are not entirely new.
Right, and if you talk to some of the vaccine experts, they also talk about the fact that, you know, there's some of the concerns that people have is, well, this has only been several months of vaccine development. But really, we have to remember that this built upon additional vaccine work that was done all the way back to SARS vaccine, 2003 and 4, and then Middle East Respiratory Syndrome, MERS, and later on, you know, about a decade later. And so you add, so this is not just several months, this is building on, that's what we do in science, is we have scientific information, we build on it, and we build on it, we build on it. So it's not just, you can't just look at the top layer of a cake, you got to look at the summation of all the layers of that cake that went into developing a safe and effective vaccine. So Dr. Persse and I, Stephen, you as well, we all agree that when it is our time, this vaccine, these vaccines are safe, they're effective, and we've got to get them. That is our way out of this pandemic. And that is a key message that we have to make sure our entire community knows.
Yep. Absolutely. For those of us way down at the bottom of the list, how do we find out about clinical trials that are still accepting candidates?
I don't know that we have any that are locally that are still enrolling.
I don't know if any locally. There, you know, obviously there are some ways that you can probably Google some stuff that will look at some of the manufacturers that are doing this. But I will say, manufacturers, academic centers, or even FDA. There may be all three of those. But I will say that the vaccines have been not tested in those under the age of 16, as well as pregnant women. And so those two categories are now where some of the vaccine trials are moving towards. I think pregnant women, unfortunately, are going to be probably last, because it's always been a concern about trying to give vaccines to pregnant women. There's always a concern because of the fetus. Not that you can't give vaccine, it's just that in terms of trials, it's always later in the testing phase. But kids, I think, is going to be the next group, and so that would be a place where people could sign up.
Pfizer's vaccine requires what looks like expensive packaging. It appears this will be an annual vaccine, and it probably will not be free next year. How much does each vaccine actually cost?
Good question. I have no idea.
I don't know the actual vaccine cost, but again, I think we want to make it clear that the vaccine to the consumer, the individual community member, is free. You may have a cost that goes to your insurance or to a third-party payer like Medicare or Medicaid, but it will be free to you, the individual, and so that should not be a barrier.
I'm not a nurse, but work with elderly patients in their homes. The families want me to get a vaccine as soon as possible. When would the soonest this could happen? Actually, this probably would fall under home health care, wouldn't it?
Yeah, I would think so.
So that's actually in phase 1A. I think. Yeah.
So soon, I guess, soon, as soon as we can get the vaccines available. Really, the key is it's the kind of work that people are doing that puts them in certain categories, and I think folks can look at those categories that are online.
The one thing that this question brings up are going to be the people who, I could interpret that question to be somebody who takes care of elderly folks but is not part of a formal home health care company, and that's going to be somebody who's going to, unfortunately, it's somebody who may fall through the cracks, right? So, and there's going to be that, and I think we as a community are just going to have to understand that there's going to have to be some way of trying to make sure that those who are prioritized above others, get it, and there'll be those who think that they should be but they can't prove it, and that's.
I see that as a role of our local health department here to really work with those groups of folks to see can we link them up with providers.
That's right.
And I think initially, David and Stephen, that when we don't have a lot of vaccine, we're going to try to, as a society, be restrictive on who gets the vaccine, because we're trying to prioritize those who are going to be most benefited by the vaccine. When there are more vaccines available, then we're going to be more permissive. We're going to allow more people. We're going to want more people. Right now, it's just that we just don't have enough. So you're just trying to figure out who gets the vaccine first.
After getting the second dose of vaccine, should we continue to wear a mask? If so, why?
So yes, and for a couple of reasons. One is the purpose of the mask is a little bit to protect you and a lot to protect others. The vaccine we know works. It's got 95% efficacy, which means that there's a 5% chance that your immune system won't respond to it. So until we get herd immunity, there's still at least a 5% chance that you would be susceptible to getting it and spreading it to others.
Okay. And we don't know who that person is.
And you have no
so,
idea who that person is, right?
That's right.
Prior to getting my medication refill, I got a blood test and need to see my need to first see my PCP. Prior to the vaccine, will my PCP need to refer me and say I am okay to take it? It's wondering, I think, whether or not really there's a prescription that's required for this.
Yeah, so there's not a prescription required for this, no.
I don't think so, to answer the question, but you know, one thing that does come into play is that we do know there were a couple of adverse cases in the UK, and these were people who had previous allergies to vaccines, severe allergies to vaccines. So if you had a primary care doc or a physician who wrote something like that you have a severe allergy, or if you know you have had an allergy and you want to make sure it's not severe allergy to vaccine, go talk to your healthcare provider so that we can get the right information to those providing vaccines.
And the next question is kind of in line with that, and I'm just going to make it short. Are vaccines contraindicated while taking other medications? And in this case, they're saying an antibiotic.
No, they're not. No. And you know, one thing about the allergies is that, remember, at this point, it's only allergies they're saying to injected medication. If you had a severe allergy previously, a severe allergic reaction to an injected medication, so that doesn't mean, it means food allergies, latex allergies, non-injected medication allergies, those are not reasons to worry about it.
That's right. Don't count. That's right.
Flu season is well set, time of year-wise. This virus doesn't seem to own a calendar. Presuming this requires an annual vaccine, will it be based on a year since we received it or during a set time of the year? It would be nice to get all vaccines at the same time.
Yeah, good question. Part of it is what we're still learning is how long does someone who gets vaccinated, how long does their immunity last on average? It'll be a little bit different from one person to the next, but on average, and we don't really have that question yet. It may be 6 months, it may be 5 years. We don't know yet.
That's right.
If we do not get the second dose after 21 days, is there a limit of time after which we would have to get the first dose again? And that you're referring to the Pfizer vaccine for the 21 days.
Yeah.
Here.
Yeah, and as I remember reading that there is, I can't remember what it is though, but if you don't get your second dose within a certain time frame, you'll be expected to repeat the whole series.
That's right. That's right. I believe, and again, I thought it was more like a week to 10 days or something.
Yeah, it was
a very short
it was pretty brief
window.
right.
Yeah.
So
you
so
don't
it's
have
21
like,
days.
yeah.
And they'll let you get it up to 4 days before then, and I think maybe like a week after the 21 days, but it's a pretty narrow window. So don't drop the ball on getting your second shot.
That's right.
Otherwise, you have to get 2 more.
You may have to get it on the whole
That's
series
right.
again. Right.
And the first one doesn't give you the boost. It sort of revs up the system, but it doesn't give you the boost to really get you the 94, 95% effectiveness. So you got to get that second. So if you waited another month and you were supposed to get that second, and you waited now another month, and now you got to start all over, guess what? You're starting all over.
Yeah, and that's actually a song, you know. I assume you're supposed to get dose 2 on the same vaccine you've received dose 1.
That's right.
That's correct. If you go back to the same place, will they track it?
Well, they should, but they're also, after dose 1, you're going to get a card or something that you have as well. So we would advise you to hold on to that card so you can take it, but you're supposed to go back to the place where you got the initial vaccine so you can get your second dose.
Okay, thank you for joining us with COVID-19 Talk with local health authorities with Dr. David Persse, Dr. Umair Shah. We'll be right back.
Houston, we have a problem, more like a pandemic, and now it's all of our responsibility to make sure we end it. So this is a declaration for us. 3rd Ward to 5th Ward, we can't afford to lose this. It doesn't matter which state open first. We cannot allow this virus to get worse. Memorial, Main Street, A-Leaf, Acres, Home, Sugarland, and Sunnyside. Trust, we know it's hard to stay inside of your home, but you are not alone. And when you do leave, mask up. If not for you, then for other Houstonians. River Oaks, West U Heights, Higham Park, Galleria to Greens Point. May we point out to you that keeping your distance is still the safe thing to do. Remember, there are people on the front lines. Show them we still have their best interest in mind. East End, 2nd Ward, Midtown, and MLK. And if we didn't name you, the same is true. We all have a job to do. Please wash your hands and get tested. It's time we invest in this great city, because where others may not have a solution, this is Houston, and we must protect the H.
I hear someone go, "Didn't it come from you guys?"
Strangers cough at me.
Move away from me.
Someone spit towards my direction. All the stereotypes that we've worked so hard to break are just going to be reversed. And I won't let that happen.
We all have to play our part.
I donate my plasma.
I've been making masks.
We deserve respect as much as everybody else.
I'm a firefighter, not a virus.
I'm a mask maker, not a virus.
I'm a nurse.
I'm a delivery woman, chef, a neighbor, artist.
Bus driver.
I'm a doctor.
Fight the virus. Fight the virus.
Todos tenemos nuestras pequeñas rutinas. Cosas que hacemos casi sin pensar y que no podemos olvidar. Que repetimos una y otra vez por nuestra seguridad y por la de nuestra familia. Ahora tuvimos que añadir algunas más para proteger a todos. Cada día cuenta. No te olvides. Ponte la máscara. Distánciate. Lávate las manos. Hazte la prueba. Hazlo siempre. Haz que cuente.
Wash your hands. Avoid sick people and touching your face. There are everyday actions to help prevent the spread of respiratory diseases. Visit cdc.gov/COVID-19. Brought to you by the National Association of Broadcasters and this station.
Welcome back to COVID-19 Talk with Local Health Authorities. With me is Dr. David Persse, representing the City of Houston, and Dr. Umair Shah, representing Harris County. And with 2 days. With us in our audience is past President Kathy Finninger of Rotary Club of Houston, who every week provides us with all of these questions and actually texts me during the show with additional questions. Emotional health. The pandemic is making people rather defensive. I innocently asked how someone was doing, and their response was, "No, I don't have COVID." Are you seeing more anger management issues?
Well, maybe with that person, I do think that it's brought out emotion for all of us. I mean, this has been very difficult. I mean, wearing masks and being reminded constantly about washing your hands and your distance, and you want to be with your family and all sorts of issues. So you all have a mental health hotline, a helpline that's there. We have a place where people can call as well. There's a SAMHSA, Substance Abuse Mental Health Services Administration agency at the federal level that has a hotline. We've just got to remember that we're all going through this, and we have to be patient with each other. Yeah. I think that's the key message.
Yeah, and the other thing is we're seeing the crime statistics are reflecting the increased stress. So yeah,
absolutely.
And substance abuse and overdose and things of that nature. Yeah.
I'm young and healthy and have been refusing to meet in person since this all began to keep my parents safe. My friends are loading on the pressure, and I'm stressing over this. No one I know is sick. People my age are not getting a vaccine anytime soon. So when can I stop hiding?
Well, first of all, let me applaud this person for their effort in protecting their parents, and I'm sure your parents are proud of you. And I've got a young person in my family, and there is tremendous pressure. Because at that age, and you're in your 20s and such, it's a very social time in your life, right? And there's a lot of pressure to go out and visit with folks. And so I forgot what the question was, but when can I expect it to be? Probably summer. And keep it up. Congratulations. Good for you.
Yeah. I have a close family member that just tested positive this past week, and this is not a joke. This is not a hoax. This is true. People are getting infected, and as this person describes, the symptoms are not easy. I mean, and unfortunately, this person, a family member, is actually okay. I mean, there's not been hospitalized or anything of that nature, but Stephen, I'm telling you, it's not easy. And so the best thing is prevention is worth a pound of cure. Just prevent yourself from getting sick. Yeah, and every day at the press conferences, we see that there are a number of people who actually die.
Right.
Yeah. Right. A group I belong to looks forward to seeing each other on Zoom. A few older members who are very adept on computers refuse and say they will wait it out until we can meet in person. Is this a phobia that we should try to encourage them to work through?
Is the phobia to be on Zoom?
No, the phobia of Zoom. Probably not a phobia.
The phobia of computers? I don't think it's a phobia. I mean, I understand if the other folks, you know, they're used to meeting in person. Whatever reason they don't want to Zoom, I get it. But meeting in Zoom, you know, we just talked about the mental health issue, and the ability to connect with other people is really important. And while it's not ideal, it works.
Yeah. Post-pandemic, I've heard that there may be an increase in PTSD that could trigger even by hearing someone cough. Any proactive remedies?
I don't think that proactive remedies necessarily, but I just think we have to continue to understand the fact that we're all going through this. And then we have to remember at some point, and even now, just because somebody has a cough doesn't automatically mean that it's COVID. Yet, we also don't want to minimize it. The cough is an incredibly important sign of potentially COVID too. So, you know, it's just keep everything in balance and perspective.
So yesterday at the mayor's press conference, as we were getting ready, just before we got ready, somebody said something that was kind of funny, and I kind of chuckled. And when I did, a little bit of saliva went down my windpipe.
And you coughed.
And I'm like, I need a cough. And I'm like, I'm not coughing.
Yeah, right.
And I struggled.
You're holding everything in your mouth.
Very quietly, and I finally cleared my throat. But if I start coughing, everybody's going to be...
Look at this.
But he coughed upstairs with me, and the first thing he says, I don't have COVID.
And then what I said, I don't think I have COVID.
Yeah. The contact tracing smartphone applications are being used in some locations to see if you've been in contact with someone who is positive. Is that self-reporting, or are physicians or hospitals involved?
So I know about this because it's actually being used in Washington. The state of Washington, the Department of Health actually just released this a few weeks ago. And I'll tell you, it's really the work with Google and Apple and these you know, devices, and it's really Bluetooth technology for the individual. And it's supposed to, you turn it on, and then if you and I have been in contact with each other, our phones, if you light up positive for COVID, our phones will do the contact tracing work to inform you that you've been in touch with somebody who's been infected with COVID-19. The reason that we don't have it is because it's actually turned on at the state level, and Texas is not participating right now.
I was in close contact at work with a person who tested positive, asymptomatic. I have 2 negative tests in 7 days. He can go back to work in 10 days if still asymptomatic, but I must stay home for 14 days. This is frustrating.
It is frustrating. But the point is that the incubation period can be up to 14 days. And so
I keep testing negative even though others around me are positive. Could I have natural immunity? Would an antibody test show if I've actually had it and didn't know?
So an antibody test will tell you that, yeah. Your chance of having natural immunity is
probably not too
probably
close
not, but you may have had it in the past, been asymptomatic, didn't know it.
That's right.
Researchers say long COVID patients may have more autoantibodies which make the virus worse by interfering with the immune response. Can this be tested for this? Can we be tested for this? Could it interfere with the vaccine?
Well, I don't think that we understand the pathophysiology of the long hauler yet, so until we understand it clearly, I don't know how you would test for it.
Yeah, that's right.
Okay, we have about 1 minute left, and Umair, I'm just going to leave that up to you to talk to the audience. Any pointers you want to leave us with? Or?
Thank you, Stephen. Thank you to both of you, and again, just what you both have meant to me is, and to public health in this state is amazing, and just incredible for me to be leaving this community in great hands. So please take care of this community. I care about it so much. What I would just say is that, you know, at the end of the day, the work that we do is not always easy. It's not always well regarded. Not everybody understands it. But nevertheless, that work needs to be done. And so with the audience, what I would just say is please protect yourself. Please listen to us. We have your best interests at heart. We're not trying to figure out or game a system. What we're trying to tell you and help you with is understand that at the end of the day, if we work together, we can get through this pandemic, and we will, but we need your help as well. So wear your mask, wash your hands, watch your distance, get tested, and get your flu shot, and when it's time for you, get your COVID vaccine.
And with that, I'll close. Thank you for joining us with COVID-19 Talk with local health authorities. Dr. David Persse, representing the city of Houston. Our friend and colleague, Dr. Umair Shah, representing Harris County for today. soon to be Secretary of Health for Washington State. Thank you to past President Kathy Finninger, Rotary Club of Houston, for providing all of these questions. I'm Stephen Williams, Director of the Houston Health Department.